Good morning, friends. This is our second video on disruptive and knowledge-enhancing literature. In this particular video, we will discuss about why carotid web needs to be stented. So some of the key aspects about carotid web: it's a sheet of intima, and there is no medial involvement. The incidence is approximately 1% in the general population. But when it comes to ESIS, the incidence goes up to 13%, and the annualized risk of stroke despite medical therapy is close to 10%. Some of the higher risk features with the carotid web are the length of the carotid web, if it is more than 3 millimeter, and if it occupies more than 50% of the carotid web, and if there's an acute angle between the carotid web and the wall of the artery, then these are considered to be higher risk features. To understand why it is important to know the risk of stroke is high, we need to know a little bit about the hemodynamics. The first thing you need to know is what is stress. This is pressure, that is force per unit area. There are two kinds of stress. One is the normal stress, which is perpendicular to the wall of the artery. The other one is a tangential stress, which is parallel to the wall of the artery. See, more and more we'll be talking about the shear stress, which is the cause for most of the problems. To understand what goes on in a normal carotid bifurcation, so this is the common carotid artery, the internal carotid artery, and the external carotid artery. This is the bifurcation. This is the flow divider. So imagine there's a jet that comes from the common carotid artery and enters the internal carotid artery. The flow is separated from the wall of the artery at the separation point, and there is a dead space between the wall of the artery and this flow jet. So the blood from somewhere else has to enter this flow region. And what happens is the central zone, which has a high velocity jet, if you see this is around 70 centimeters per second, this hits the flow divider, takes a circumferential route and reaches this dead space. As it reaches the dead space, you see the velocity drops significantly. It goes down to 2.5 centimeters per second, goes backward, and then takes a forward course into the internal carotid artery. There's another pattern, which is a helical course, which goes into the dead space and goes antegrade. So this point here, there's maximum residence of blood flow, that is stasis of blood. And this is the cause for majority of the problems. It causes elevation of inflammatory markers and promotes atherosclerosis, both on this wall and in this wall of the external carotid artery. The paper we'll be discussing is being published in Nature just recently, which looks at the hemodynamic parameters in carotid web and compares it with atherosclerosis in normal patients. So this is a velocity map. If you see here beyond the carotid web, there's a large area where the velocity is less. If you look at atherosclerosis, there's no drop in velocity beyond the atherosclerosis. Whereas in normal patients, we do see some drop in velocity beyond the bifurcation, but this is much smaller as compared to the web. The percent of volume which has a velocity less than 3 centimeters per second. This is the key factor. Less than 3 centimeters per second promotes stasis as well as thrombi formation. So in web, there's a large percent which is less than 3 centimeters per second as compared to atherosclerosis in normal patients. This curve looks at how long during the cardiac cycle you have a volume that is less than 3 centimeters per second. If you see in carotid web, throughout the cycle, there is a percent volume which is less than 3 centimeters per second. However, if you look at normal patients, atherosclerotic patients, in the cardiac cycle, there is a period where the velocity jet is much higher. This allows for clearance of debris in both atherosclerosis and normal patients. However, in carotid web patients, as the low velocity jet persists throughout the cycle, we are unable to clear this thrombi. And this causes what is called as a red thrombus. Wherever there's low velocity, the shear is also low. We see a low shear. So if you look at the web, the shear rate is lower. That means the percent area of low shear area is higher as compared to atherosclerosis and normal. So low shear rate causes inflammatory markers to go up, and it causes what is called as red thrombus. Whereas high shear, which is seen in atherosclerosis, causes platelet-rich thrombus. There's another feature that we need to discuss is the oscillatory shear. So beyond the web, there is a to and fro movement of this blood, which we call it as oscillatory shear. And there's a high oscillatory shear index beyond the web as compared to the normal. In atherosclerotic patients, the oscillatory shear index is extremely low. And this oscillatory shear index is correlated with endothelial dysfunction. Like in this patient with a stroke, you see there's a web, the length is small, but there is a significant stasis beyond the web, which shows the hemodynamic parameters really are affected with this intimal flap. And we went ahead and stented this patient. So the key take-home messages in a carotid web are, beyond this flap, there's a very low velocity region, which correlates with a very low shear rate and a high oscillatory shear index, which all promote thrombus formation. Again, the percent of volume with low velocity is significantly higher in the carotid web compared to normal and atherosclerotic patient. And the duration of the cardiac cycle at which this low velocity, low flow persists is much longer in the carotid web as compared to the other group of patients. That means the stasis is significantly prolonged. Therefore, the thrombi are not cleared, and it more forms red thrombi than platelet thrombus. And post-carotid stenting, the risk almost drops to zero in these patients. Thank you for your patient hearing.